How does that look on your end?
Oh, that's perfect, man.
All right.
Okay, now we're going to go live on Facebook and see how this works.
Sounds good.
Because I know we won't be able to see it, but I'll have my phone on so I can watch it.
Yeah, I'm on my other phone right now. So.
It's always cheat to make sure it works. I've done a full live, damn thing didn't record one bit. I was like, really?
Now, would you rather my camera was sideways, or do you like it this way?
It doesn't, whatever you feel comfortable with, I'm fine.
Doesn't matter.
Nah. What do you want the title to be? Anything specific?
Whatever you like.
Understanding your health.
There we go.
That'll work. Here we go.
All right, I think we're good. I think we're live.
We're live. Yeah, definitely. Okay, cool. Thanks everyone for being here. This is Sean. I am a high performance coach, also going to soon to be a certified hypnotherapist. So taking it all kinds of ways in which to help out, the mental side, give you the utmost advantage to get yourself out of your own way. And I wanted to bring on a special guest that I friended on Facebook. Come to find out he lived in the area here in Clearwater, now in Orlando. His first name is, am I pronouncing it right, Tomo, right?
Tomo, yeah, it's actually not even my legal name. My legal name is Tomislav. So it's like a Thomas and Tom in Croatian.
So you're Croatian, huh? Cool.
I am, 100%.
How do you pronounce your last name?
Last name is Marjanovic.
Marjanovic, okay, perfect. So the reason I wanted to have Tomo on, I'll give you guys a quick background if you don't know. I'm a cancer survivor who had testicular cancer. I actually had Lance Armstrong's doctor, Larry Einhorn. With going through chemotherapy and all the drugs they gave me from that, they basically said I would become sterile. So I disproved them on that. I have a 9-year-old daughter, but at the same time, your testosterone level in a male will drop significantly. And what happened was I was going through a urologist to get some hormones to balance out my hormones, because people don't realize that testosterone doesn't just have a sexual function in the human body, especially the men. It also has a lot of other components. And the problem with going through a urologist is my insurance would cover it, then they wouldn't cover it, I wouldn't be taking it. And you don't want to get anything on the black market. And that means illegal steroids. That's what testosterone was referred to back in the day. So I've been on I would say in the last few years, a very minimal amount. But again, it keeps my levels perfect. And Tomo and I have talked on the internet. He actually has a company, which you can see right there, that does this. I would love for you to give us a background about, where you got started in the health and wellness journey for yourself, and then what brought you to where you're at right now.
So for health and wellness, that started at a very young age. I was 13 years old when I got my first gym membership. I went to Croatia to visit family, Croatia and Bosnia to visit family, and I ended up growing about 7 or 8 inches in 3 months. So I had a massive growth spurt. I don't know if it was because of the Croatian food or the air or the water, or just the timing. But I came back to the United States and I had aches and pains everywhere, joint pain everywhere. I mean, I even have stretch marks on my lower back from growing so tall so fast. Wow. So it was a lot of growing for me. The doctors that I went to at age 13 told me to go and strengthen my muscles around my joints, basically because I grew too fast and everything was very weak. So I had a lot of knee pain, elbow pain, back pain. So that's when my fitness journey started. And I worked out ever since religiously for years and years. I was a competitive bodybuilder when I was in my late teens. I again started competing as a bodybuilder in my late 20s and early 30s. And during my whole bodybuilding process and everything is when I learned about hormones, hormone replacement therapy. Back then, clinics like this didn't exist. So, you know, any hormones that anybody was talking about were basically steroids,
Right.
things that bodybuilders took. And, you know, I started researching a lot. At the age of 20 or 21, I told my bodybuilding coach, the guy who taught me everything I knew about working out and training, I told him I was thinking about being a professional bodybuilder and I wanted to look into taking steroids. So the first thing that he told me, he says, no, we don't know what your levels are. He said, if you don't need hormones, you shouldn't play with them. So, you know, and this was years and years ago before anybody was testing people's hormones like we are today. And I got my testosterone levels checked and my levels were between 1,300 and 1,500 in 3 tests.
Yeah, you didn't need anything.
Exactly. So he told me, he said, you don't mess with a good thing. You keep them where it is and you just keep going about your
So
day.
let me give people a perspective. When I was done with my cancer treatment, I was at 185.
And see, that's it's all relative to people too, because it's funny. Let's say you at 185, you were symptomatic. I started to become symptomatic of low testosterone in the 690 range because my natural normal level was always so high.
Right.
You know, dipping down, it's a 50% drop from 1,500 testosterone level. That's a pretty significant difference for my body.
And that's what I think people don't realize. It's not necessarily the range in which you're at. It's the range in which you were at to where you're at now. So like you were saying, I never knew what my normal was, but I knew when I wasn't on anything and having to deal with all those drugs, that 185, because the reason I got tested is we wanted to get pregnant and they're like, you can't take any synthetic hormones whatsoever. I'm like, okay, so how am I going to stay awake? Because people are like, what do you mean? I'm like, if you don't have testosterone, you fall asleep all the time. You're lethargic. It affects every other hormone. To me, it did in my system. And I know it's not specifically that, but you're just moody. It's like male menopause in a way. You're cranky, you're irritable, and your blood pressure goes up and down. You think you're like you can have anxiety attacks. I had a few of those. So I was drinking so much coffee, it was ripping up my stomach. So I went and had to do some of my own research. So I talked to a general practitioner. They're like, well, the only thing we can recommend is you go to see a psychiatrist because you don't have ADHD. We need to get you on some Ritalin or Adderall. Like, okay. So I walked into the office. I said to the lady, hey, this is going to sound strange, but here's my research. She's like, that's genius. She goes, you just got to come in. We'll talk. I'm like, about what? She goes, I don't know, whatever you do. So I was actually helping her with her husband, which was funny. I wasn't seeing a psychiatrist to see a psychiatrist. I had to do it for the prescription. That prescription saved me energy-wise, but the grinding and the loss of appetite, I mean, wasn't great. And that was the only alternative back then, which was almost, 11 years ago, which was, they didn't know what they were talking about back then. So when you were at the 600, what'd you do next? Did you do anything about that?
So yeah, I went and got my levels tested because I started to feel the normal symptoms that I knew about. I started to feel lethargic. I didn't have any energy. I was very tired all the time. Workouts were lagging. I felt myself kind of gaining fat in my trunk area.
Muffin top?
Yeah, a little bit, which is strange for me because I was very used to having a 6-pack. I very much liked looking like that.
Right.
So, I had all these symptoms of low testosterone. So I'm like, all right, I'm going to go get a, blood panel, get everything checked. And I got it checked. And if I would have taken that blood work to any normal practitioner, they would have looked at me like I was crazy.
Right.
They would have said, no, you're just trying to get steroids because, you bodybuild. They don't really think about the fact that I was at maybe a 12 to 1500 level and now at under 700, I'm extremely symptomatic and I actually have all of these symptoms.
And why did
With
that happen is the question we don't know.
age,
Right.
age, it's very simple. And especially here in America, I am first generation American. So I think my levels were a little higher than people that have been in America for a long time. And there's speculation that's because of the food and water supply.
So let's talk about some outside elements that can lower testosterone in men and even women. So what do you, I mean, I know some certain factors that can do it. What would you say the leading cause of suppressing testosterone in males is caused by right now?
Right now, I would say our food supply.
Okay.
There is, and of course, genetics, everything play a part. There's a lot of speculation on that, but there's really not a lot of data that you can really say is clear, concise data, even with the food and water. But one of the biggest things, there's a book called Estrogenics.
Okay.
I forgot the PhD doctorate that wrote it. I don't remember his name offhand, but it's amazing all of the evidence that he actually combined in this book, talking about how there are all of these estrogens, phytoestrogens, and everything in our water supply and our food supply and everything, and it's actually making men less men. It's
the thing that's interesting is plastic bottles, prescription drugs.
Yep.
What I know of pesticides and herbicides, the amount of vaccinations that go into our protein we consume, like your beef, your pork, your chicken.
Yep.
And then the levels of stress that we're under are another significant cause of suppressing, testosterone. But the main thing that people also don't realize, it's not just testosterone, it's estrogen and progesterone in men. So what would you say, what are the issues with estrogen and progesterone too?
So progesterone, it's really hard for a man to have a out of whack progesterone.
Okay.
It's not as common as some doctors and some clinics might think. We very rarely see it. I think we've seen it in like 2 patients here, and
Gotcha.
we're upwards of 1,000 full-time patients. So it's very uncommon. When it comes to estrogen and estrogen side effects, there are a slew of issues going on with how that's treated right now. The main cause is really not estradiol like everybody thinks, where you have your blood test, you're testing your testosterone, your free testosterone, and you're testing a estradiol level. What people don't understand is that estradiol is actually extremely heart protective and healthy for men.
Right.
So with let's say me or you, let's say we have a testosterone level of 1,000 right now.
Right.
And that's going to be super physiologic to any normal blood test, but that's where we operate best at. So that's where our testosterone is. For us to have an estrogen level or an estradiol level at a lower end where it normally would be when we were in normal testosterone ranges doesn't make sense. And that's where people start getting symptomatic, and people taking anti-estrogen tablets religiously with testosterone is giving them more problems and more harm than good. The issue that men have with estrogens is estrone, and it's a nasty metabolite of estradiol. And that's the one that's causing gynecomastia, that's the one that's causing the acne, that's the one that's causing the water retention. It's not the very prominent estradiol in everybody, it's the estrone that nobody's really checking.
And how would you go about fixing that problem if someone had that kind of problem?
So when I first started this clinic, we were referring people to get a product called FemGuard.
FemGuard, okay.
And it has a certain combination of over-the-counter supplements, and I actually sell products that are similar to it now.
Okay.
So I had them formulated by an FDA-approved facility, and they only sell to medical offices, and basically that's who's making all of my supplement line now. So the 2 substances that are the 2 products that I have are called FemGuardian, and the other one is called Dim Plus.
Okay.
So both of those taken with a normal multivitamin every day is scientifically proven to lower your estrone levels. And it does it so effectively and keeps your estrogen levels so effectively in balance.
Right.
That I personally, so this is what I personally take, I take those products and I am on no anti-estrogen whatsoever. and my testosterone is almost perpetually at 13 to 1500.
And again, what people don't sometimes realize is it doesn't take more than one thing to be out to throw everything else off.
Correct.
And then, you get into going to a supplement store, like a GNC, we'll say, and they've got all these products that are pro-hormone this and the estrogen booster this. What is your take on those type of supplements?
At this point, it's all pretty much snake water. It's a lot of the stuff is not really doing much. There are some studies that say these test boosters and things like that. They have like tribulus and
Right.
a couple other random herbs that are said to boost testosterone. Do they work? Yes, minimally. If you already have a decent testosterone level and you have a decent, your endocrine system's working at a proper way. For me and you, who have now gotten a little bit older, and for most of the population that have gotten older and have declined in testosterone, those products are not going to help them.
What's the product that's new out there that isn't considered a hormone, but is some other type of product that they have been testing, but I don't know if it's used for human consumption or not? What's it?
Are you talking about SARMs?
Yeah. What are SARMs?
Selective androgen receptor modulators is what they stand for.
Okay.
A lot of people mistake them for peptides, and a lot of people mistake peptides for SARMs because
Gotcha.
the science behind it is a little bit muddy, especially if you go on Google,
Right.
because you're going to see a bunch of bro science Google experts that are telling you what these things are. There are very few that have been studied, at any real amount and shown to actually do something positive without a massive amount of side effects. And there are compounding pharmacies that make them. The only SARM, the only true SARM that we have here at my clinic would probably be LGD 4033, which is also referred to as Lingendrol.
Okay.
And that is made by a compounding pharmacy. It is FDA registered compounding pharmacy. You can find it all over the internet, and you'll pay $30 for a month's supply, but you have no clue what you're getting.
Well, that's the thing that people don't realize. You can find it, doesn't mean it's the real thing. Now, a peptide is something completely different or similar to that.
So peptides, when you're referring to peptides here at this clinic, there's peptides of several different compounds and hormones and things like that. When we're talking about peptides in relation to aspire rejuvenation, they are usually growth hormones, secretagogues. So they are peptides that will increase your natural growth hormone levels.
Because I've worked with some people who have autoimmune issues, and they've been referred to take peptides.
Absolutely. Yeah, it's the regenerative properties for some of these peptides is absolutely amazing. One of my favorite, BPC 157, stands for body protective compound.
Right.
I have used it several times for aching knees and tendonitis in my elbows. And I've had several people that are, on the verge of getting surgery. We just had a military vet who actually just retired from the military. I believe he just came home. He was over there, had a shoulder injury and a knee injury. They were going to do surgery on his shoulder.
Right.
So he's a friend of mine. He worked in law enforcement with me for a few years. And we sent him over BPC 157 capsules. And he took them for a month. And the doctor did a new scan on his shoulder and said, whatever you're doing, you healed your issue and you no longer need surgery.
So isn't that interesting and people wonder like, oh, I went to the surgeon. They say I need surgery. I'm like, what do you think they get paid to do? And you have to understand, like, they get paid to do surgery. So that's interesting because peptides are a new thing on the block, I will call it. But the other new thing that not new to me and maybe not to you, but is the use of probiotics, digestive enzymes for what we call gut health of the microbiome. What are you seeing in that area when people come in and they want to get healthier? My whole thing is I know most of our serotonin is made in our gut. And a lot of people who are having anxiety, depression, PTSD, their hormone levels, not just in the testosterone area, but all the other hormones that support it, like your serotonins. What's your take on that?
So for most people, if they're eating a normal, regular, healthy diet and they're eating high quality food,
Right.
most of the time you're not going to be in need of a probiotic and a digestive enzyme. Most of our bodies are functioning relatively well when we're eating very high quality food.
How many people you know actually eat high quality food? I mean, me and you might know a couple, but most people don't.
Yeah. So maybe you and I do, but yeah, most people don't. We have a probiotic line, we have a digestive enzyme line here. And I tell everybody, whether they are a professional athlete, because we do have ex-NFL players here, professional tennis players, golfers, WWE athletes. Of course, I can't outwardly tell you who they are, but
right.
you know, when they tell me like, hey, I'm eating this much food and I'm having a problem with digestion and I feel sluggish when I eat, I need to change my diet. I tell every single one of them, I said, before you change anything, because I know what kind of diet you're on and why you're on it.
Right.
I want you to take these two products and see what it does for you. And almost every time that's the issue that they have. They're not eating high quality food.
Right. And the thing that people also don't realize is that stress screws with all kinds of hormones. And the big one is a cortisol issue. I would say the biggest rise, and I've worked with a few people, are stomach cancers are on the rise like I've never seen before. And digestive tract issues from IBS to Crohn's disease are one of your major players that a lot of people don't really want to talk about. And they think, like, is it gluten that's bothering people? Here in the United States, I eat gluten, my stomach swells up, looks like I'm 4 months pregnant. I was over in Italy, no problems whatsoever. So is it gluten or is it the byproducts that are in processed foods and breads and cereals and things of that nature here? So when it comes to like the probiotics, digestive enzymes, those definitely help me out when gluten slipped in, maybe because I drank a beer. But okay, so it's one of those things where once in a while, those particular products help me. And I think that's what that thing's really good for. And again, I've worked with people who their children who have autism, who have ADHD, and I'm like, are you looking at the chemicals in which are in the food your child's consuming? Even the coloring, the dyes have huge impacts on learning abilities. What do you see also is something that's really important? Like a lot of people think vitamins are in your daily vitamin. I'm like, well, vitamin D technically isn't a vitamin. What do you recommend about vitamin D? And I know with this virus going on, they're recommending people to take a lot of vitamin D and a lot of vitamin C. And I think there's a misconception on the vitamin C because, again, it's water soluble, so it's in and out of your system. What's your take on the vitamin D first and then vitamin C after that?
So vitamin D, it actually acts as a hormone in your body. So I will give you an example. And one product that we have here, it's a testosterone. I have a testosterone product that has 200 milligrams of testosterone in it, but it also has 5,000 IU of vitamin D in it.
Really?
And I get people asking all the time, like, oh, why do you combine vitamin D? I take vitamin D all the time and this and that. And I'm like, listen, you think you're getting vitamin D from your food. You think you're absorbing the vitamin D you're taking from the Walmart supplement that you bought. Realistically, you're absorbing 5% of it probably. And when it comes to your hormone pathways, the way that your receptor sites work, everything like that, vitamin D plays an important role on all of it. And we're talking about the receptor sites.
Yep. You got a phone call coming in. There you go.
Did we get it? All right.
Yeah, you're good.
We're talking about the receptor sites in your brain, the receptor sites all over your body, your gut. So vitamin D plays a super vital role with everything that has to do with your hormone pathway.
And then when it comes to vitamin C, people are like, well, all these new studies and in IV vitamin C or vitamin C. And I'm like, well, okay. Your body has to be able to absorb the vitamin C.
Exactly. Sorry, I'm going to grab my phone charger. It's actually my phone dying on us.
Oh, we don't want it to die.
Okay. So vitamin C, yes, water soluble. The absorption on it is not great. You're not going to, I don't know what the right word is. You're not going to stave off every illness on earth by super dosing vitamin C. If anything, it can actually make you sick and give you diarrhea.
Yeah, it does clear you out.
Yeah, so I've actually taken it as a diuretic before for bodybuilding shows.
Right.
Yeah, so people really people really think the information on health and food supplementation that they're getting from mainstream media and from everything they read online is 100% factual. Half of it is extremely biased. The other half is just basically ignorant.
I mean, and this is why I wanted to bring you on, because there is so much information out there, and people are they take calcium, and I'm like, what are you taking your vitamin D with? What type of calcium? Because if you don't have certain things combined, what I know for a fact that most people are zinc and magnesium deficient, and they're like, what do you mean? I mean, these are all simple things. When we get them to their optimum levels, we actually have a better chance. So the things that I do in coaching is strengthening people's mental fortitude so they can be able in their own way to take more risk to be better. Mm-hmm. What I know is, unless someone knows their hormone levels, if they're not taking all these supplements that we've talked about, I'm actually fighting, and they're fighting with themselves to become better. Because yeah, we can have a conversation, they can be motivated, and then when we're done, what's that thing going on? And sometimes they think they're mentally not, doing well, and I'm like, it's an imbalance in your system. Yeah. So when a person comes to see you, what do you recommend that they do?
So we obviously check labs. We do blood work for pretty much every patient that comes in here, especially when it has to deal with hormones.
And what type of person are you serving for the type of work you do? It's not just the bodybuilders, the people in shape, fitness. What's the gamut of type of range of clients?
So the youngest client that we have, I believe, is 19.
Okay.
Has a pretty severe hormone deficiency, and we're treating him for that.
Okay.
And the oldest patient, I think, is in his late 70s. Gotcha. So we run a huge, a wide range of ages.
And it's men and women too, right?
Yes, it is men and women. And, the more men that I'm getting in the clinic, the more they're bringing their wives and girlfriends to us, because they see what we're doing. They ask, hey, do you also treat women? Because they feel good. So what is a major issue that a woman can have that most men or even women themselves wouldn't be aware of? So most women don't realize all of the hormones and the way that they work in their body. When I mention testosterone, or one of our practitioners mentioned testosterone to a woman, the first thing they think is, I don't want to have 20-inch arms, and I don't want to grow a beard, and that's what they think.
We don't want them to grow a beard either, necessarily, unless they're into that.
Trust me, I like them coming in looking like women, so I don't want them having those issues either. But when it comes to testosterone in women, when they have low testosterone, it is not much different from a man. Their sex drive is low, their energy is low, they have extreme brain fog, they feel unmotivated. So there's all the issues also for women. Now, we will both agree on this because we're both men. Women are much more complicated than we are.
Hormonally, we'll say. We'll just leave it at that.
We'll leave it hormonally for right now. Yeah, so with hormones, their estrogen and progesterone levels, they run a huge difference, the difference between when they're maybe on their menstrual cycle, when they're postmenstrual, when they are postpartum, when they're getting into premenopause, and then during menopause and postmenopause. So these hormones are changing drastically throughout their lives, and sometimes throughout the week, and sometimes throughout the month, depending on what they're doing.
And again, there's so many women that my wife and I work with who are so stressed out that adrenal fatigue is becoming a huge issue. And that is
over-caffeination and adrenal fatigue.
And again, they're wondering why they feel the way they do. Their hair starts falling out, their skin starts looking weird, they're real dry, their skin gets dry, they don't know what's going on. Like you said, brain fog, irritability, and people think they're going crazy. And then they go to their general practitioner, and what do? They put them on something to help out them in a mental capacity, which they don't need to be on something for depression or anxiety.
Yeah, and those are two of the biggest symptoms sometimes for men and women that have these hormone issues.
Right, and what do? They put them on a drug that really doesn't solve the problem. It puts a Band-Aid on it, and that's why I wanted to bring you on to explain to people, like, you don't have to feel bad before you actually get checked out to feel better. Because as you know, you got to get someone to normal, and that takes some time. It's not like, oh, here's this, here's that, you'll be fine. You're also doing blood work as they start to change because you don't want to go too fast, too far. And that's the one thing I think that people are like, oh, you come to the clinic, you get a blood test, they give you your stuff, and you go. No. What usually happens after someone has gone through their initial blood work, they see you, then what's the follow-up after that?
So once they see us, let's say the patient gets a treatment program, let's just say it's TRT. Let's say a male comes in and they get treated for low testosterone, so they start on testosterone.
Okay.
Usually, they're not going to start feeling the effects of that testosterone therapy for at least a few weeks. So let's say 4. So the first month
but there is that, pseudo psychological effect, which is interesting.
Yes, I felt it. I think a lot of men feel it, but some men don't. Some men aren't in tune with it either. So let's say it takes 3-4 weeks for it to kind of get in your system. You start feeling better. By the time the next month goes by, so we're looking at like 6 to 8 weeks, we're already rechecking their labs.
Okay.
So now we're going to see on a follow-up lab panel, what are their hormones doing? We're going to talk to them, ask them how they're feeling, and then we're going to make adjustments as needed, because this is not a cookie cutter approach,
Sure.
and many clinics do a cookie cutter approach, and however they do it is fine, but they're really doing a disservice to the patient.
And that's the other thing is what my big thing, and the reason I also wanted you on here to talk to you about this is psychologically, when we're in depression or we have some anxiety going on or we have a lot of stress and these hormones start to take effect, there is a huge positive shift in someone. But at the same time, they've been so dialed in and attached to that negative, sick, non-motivated person, they lose their identity.
Yes, they
When
do.
you lose your identity, you try to sometimes go back to which not necessarily is best, but is comfortable, and comfortable isn't always healthy.
Absolutely. We see that time and time again, not only with this example you gave, but people do it all the time. People stay in relationships that are unhealthy because it's comfortable. People stay in jobs that they're not fulfilled by because it's comfortable. It's a basic human nature. Humans don't like to be uncomfortable. Humans do not like to stress.
Yeah, and that's my job as a coach, is to make them uncomfortable, because we know here's the thing, when you're uncomfortable, there's some form of growth, be it physical, be it mental. With the things that we don't want to do actually probably are the better things for us to help us out. So are there any case studies where you've seen drastic changes in a positive way in any of your clients or patients?
Yes. So probably the most identifiable one was a older patient. He was extremely wealthy. So this guy comes in, he's driving a $150,000 car. He's got a beautiful young wife, and the guy's only maybe 54, 56.
Right.
And he's walking in like he's 80.
Interesting.
He's hunched over, he's limping, he looks frail, he looks pale. You can tell he just had a bad attitude. He had a scowl on his face. And during the consultation, which I sat in with, I was talking to him as well, because I was one of the ones who brought him in. He started talking about how he was extremely depressed, how, he didn't want to have sex with his beautiful young wife.
And he was probably sick of taking Viagra for her too, right?
He said it just didn't work. He said it
really?
Didn't work anymore.
Isn't that interesting?
Well, Viagra is a vasodilator. So
right, we know that, but a lot of people don't.
Yeah, people think it automatically, goes and works downstairs. It's not how it works. It's actually a full body vasodilation. That was a heart medication first.
Right.
So this guy comes in. He doesn't want to have sex with his gorgeous wife. He doesn't like his sports cars anymore. He has no desire. He doesn't want to work. He's just losing it. And he's like, I just feel suicidal. I feel like I want to kill myself because this is not how I want to feel. So we check his hormone levels. His testosterone level came back, and I believe it was a 12. So that's low for a woman.
Right.
So whatever was going on with him physically, something was causing this to be extremely dramatically low. This guy's never taken testosterone in his life. You know, he is a little bit older, but not that old.
And again, on paper, he looks like he's got everything. He's got the cars, he's got the money, he's got the wife. And
Yep.
that's the interesting thing is on paper, he looks great and he comes into you and you're like, oh,
Oh,
okay.
this guy poured his heart out to us.
Right.
So, you know, we look at him. He gets on a testosterone treatment program. He gets on TRT. He walks in, because this is an in-house, we're not doing this one through telemed. He walks in, he comes into the office, he's driving a new sports car. He's standing up straight as he walks in the office, brand new clothes on, smile on his face with a pep in his step. Looks like a completely different, has some color in his face, completely different person. So this guy walks into the office and I'm like, how you doing? And he's like, I feel like I'm 25 years old. He's like, I haven't felt this good for the last 20 years, and I never knew that it was something as simple as testosterone.
And that's the case because most people think it's bodybuilding steroids. And what I try to tell people is any bodybuilder got that way from training their butt off. All a testosterone or a steroid does is allows your body to heal at a quicker rate.
Exactly.
I remember back in the 80s, and God, I'm saying how old I was, in the 90s, guys would take it for 8 or 9 weeks and but they trained like so hard. Now they're having issues with joints and things of that nature. But nowadays, people are relying on the quick fix. And that's what everyone hears in the news. Oh, these guys are taking steroids. They're doing this and they're doing that. The reality of it is, I would say the percentage of men who are suffering like this gentleman is astronomical because of the way in which our society treats men. Like the dad bod is a lack of testosterone. When I looked at these guys who have these giant beer bellies, they're at NASCAR events, not that everyone at NASCAR event has that, I guarantee you their hormone levels are worse than most women. And people were like, what do you mean? I said, well, what do you think that gut's caused by? It's not just caused by beer and bad food. That's a hormone imbalance. That's a heart attack waiting to happen. And the big thing that they used to say is anyone who has prostate cancer can't take testosterone. That's completely changed. That is total BS. The other big
Correct.
thing is that testosterone is going to hurt your heart. We know that if you have low testosterone, you're more liable, more going to get a heart attack than you would with having it. Like that's the misconceptions of that is just blows my mind. And I'm like, no, go see an expert such as yourself. Get to know the real facts about you, not the statistics on the general public, but where you're at on all these hormones that we've talked about and how, like you said, the guy suffered for 20 years. Quality of life is important. And what we're seeing
Absolutely.
now is the amount of stress in this world because of a virus that has been really pushed out there, and there's conflicting information on both sides that people are so confused, even by the quote experts. The experts themselves, not different experts, but one expert has changed their mind because they don't know what they're dealing with. What I know is you're an expert in this field, and that's why I would recommend definitely people to come talk to you about this. And then, like you said, you briefly said it, you do teleconferencing where people don't have to come to your office, and you have clinics throughout the country. Is that correct?
Correct. So the two clinics that I have right now are in Pennsylvania and Pittsburgh.
Okay.
And that clinic is run by the medical director, Dr. Joe Clark.
Okay.
And Dr. Clark is currently, he's going to be doing part 3 and 4 of the WorldLink Medical Advanced Bioidentical Hormone Replacement Therapy training. So he's going to be, one of several doctors getting trained by this. And I will also hold that certification as the only non-medical person with that certification in the country once I finish in December. So that'll be very cool.
That's really cool. Congratulations on that, because
thank you.
I mean, you're passionate. See, this is the thing that people don't realize, that there's certain people who go to the gym, they used to call them meatheads. They would eat tons and tons of food, pound the weights, rah, 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 go to clubs, get in fights. And then there's like you. I started off at 12 because I was 5 foot tall, 5'2" when I started high school, and 110 pounds. When I graduated, I was 155 and I was 5'10", and then I grew. And I was in the modeling industry for Ford in Miami. I did all these crazy fun stuff. And they told me I was too lean back then and I was too muscular, and I was 170 pounds. Like, I'm 6 foot tall, 170. I was not muscular. I was just ripped. But they didn't like that look back then. It was the emaciated male. I'm like, no. So then I got into, went to college for all the exercise science and wellness. Like,
Hmm.
this is not what I'm interested in. I got into massage therapy, then I got into personal training, then I got into coaching, because what I know is without the proper hormone balance, there is no way that our mind functions correctly. And we're at a disadvantage. And what I know is the amount of Alzheimer's and dementia happening has a huge correlation to our brain health. Our brain health is definitely influenced by our hormone levels, period.
Yeah. So when we were over in Salt Lake City, Dr. Clark and we were over in Salt Lake City. The doctor who is putting on the course is probably one of the oldest, most recognized hormone experts in the world. His name's Dr. Neil Rouzier.
Okay.
You can look up his videos. He's a little controversial. He's a little brash with his viewpoints, but it's because he's been there, he has done this, and he has looked at every single piece of research behind it. So he is an extremely big proponent on testosterone therapy, on thyroid optimization, and basically optimizing all your hormones to increase your quality of life and increase your health span. So, everybody's always lifespan, I want to live to this long, what good is it is if after 55 you feel terrible?
You're going to suffer until you're whatever age. So that's one hormone we didn't talk about is thyroid, which I've seen a lot of. It's an autoimmune issue. Have you ever worked with people who had low thyroid and then as they improved their health, they didn't have to take it?
Yeah. Did I lose you?
No, you're good.
There we go. So thyroid optimization, having a thyroid issue or having, hyper or hypothyroidism, that's not what we're talking about here. There's treatment programs for that. And, that's to get your thyroid in a normal operating range.
Right.
What Dr. Neil Rouzier believes is that optimizing the thyroid, along with optimizing all of your hormones, he suggests every woman postmenopausal goes on progesterone. Every woman, not one shouldn't go on it. This is what he believes.
Okay.
And he has patients that are in advanced age and they are running around at 80 years old, running the beach, skateboarding, doing workouts, doing all this stuff. So he sees this firsthand.
Gotcha.
Thyroid is one of those things where people are always scared to mess with it because they think they're going to mess up their thyroid by taking a thyroid medication.
Right.
It's not the case as long as you are doing it. As long as you are doing it smart, as long as you are being careful with what you're doing, and as long as you're doing it doctor supervised.
Yeah, and again, what we're talking about is all medically sound information here, where you're keeping people within their normal parameters, where it's healthy and it's safe. And that's why I wanted to bring you on, because I've been in the industry of health and wellness for over, 25 years at least. But again, I'm an expert in the coaching industry, the mental side. I've done all this. And people are like, well, you're a trainer still. I'm like, no, I gave that up. But what I know is that when you influence people to take care of their own self, which coaching does, they get great results. But what we're talking about, I guarantee you walk into any room and say, hey, what's your blood pressure? And people don't know what it is. Most people don't even know what their blood type is.
Correct.
So the big thing is we avoid doctors because doctors have never really been in preventative medicine. You go into a doctor and they give you a bunch of drugs to band-aid the problem you're going on. They're not creating a solution for you. And that's why I wanted to explain to people with this type of interview with you is if they get there before they need this, then they will maintain a healthier, happier lifestyle without any hiccups along the way. And I think that's where, hey, it's okay. Maybe they come to you and they don't need your services, but at least you checked everything. And it's not like you're like, well, don't come back ever. It's, hey, I'm glad you are that concerned with your well-being that you realize that knowing is better than not knowing. Because as you know, there's so many people out there who drop dead of a heart attack or have a stroke or have high cholesterol who never thought they did. And they're like, oh, I mean, with COVID-19 right now, all these healthy people are dying. Really? How do you know they're healthy? Because of the way they look? Like, stop. There's so many people who are on medications they don't tell anyone about because they are depressed. And those medications have a huge impact on your immune system. And that's what I want people to realize is it doesn't matter how you look. It's how you're chemically balanced, how you're mentally, your mental fortitude, and understanding that, hey, if you need to talk to an expert, be it in the coaching industry, the hormone industry, we all are working together. We're not working against each other. We're actually combining what we do to get the best for our patients or clients so they can go and do things. Because my statement today, my buddy said, name one thing that you know that everyone can agree upon. And I said, we are not getting off this planet alive.
Absolutely.
Unless you're an astronaut. I had to say that. But when it really comes down to it, if you're more physically active, enjoy it. Don't wait till you're retired where you're sitting on the sideline going, I wish I would have done that. And the other thing that people don't realize is if you get injured and your hormones are correct, you're mentally more open to getting healthier quicker. Your body heals faster. Like the reason a diabetic, when they get injured, doesn't heal quickly is their hormones are all screwed up.
Exactly.
I mean, when it comes down to it, the only thing we do really have is our health. And that is based on everything coming from that, from our relationships, be it intimate, be it social, our anxieties, our phobias, all come from our health, physical and mental. And I want to thank you for being on here, man. Is there any other words of wisdom you want to throw out there to people and tell them how they can contact you also?
The one thing that I really want people to look at is just the healthcare system in general. I want people to be able to look at their health and think outside the box a little bit.
Okay.
Because, and there's nothing wrong with, with the general practitioners out there. There's nothing wrong with these doctors. They are all excellent. Most of them, I'm sure there's some that are not. Most of the doctors that I speak to are absolutely excellent practitioners and medical doctors. However, they are taught a very specific set way on what to do with patients. They are not preventative. They are not regenerative. They deal with issues as they come. So I want people to understand how they're taught and understand what they're taught, because doctors are not taught hormones. They have about a 10-minute course on it. So
Right.
they're not taught about these things. They are not necessarily interested in fixing all of your problems with just a testosterone shot, because they're not going to get paid that way. They make money with prescriptions. They make money with surgeries. And people think there's not technical kickbacks from pharmaceutical companies anymore, but they do get paid in a back channel way for all these prescriptions that they're putting out there. So I want people, when they go into the doctor's office, my grandmother, 80 years old, went in and her blood pressure was perfect. But because she's 80, the doctor said, you need to go on blood pressure medication. That's a true story that happened last week. So I'm talking to my mom on the phone, and I told her, I'm like, do not fill that prescription. I was like, you do not need to put poison in her system if she does not need it. If her blood pressure was good, which it was, she was pretty much right at 120 over 80 blood pressure at 80 years old. And I'm like, why would they even
But
suggest
just in case.
that? But it's basically, it's just what they're taught. So
Right.
The main thing I want people to do is just really think outside the box and think about what they're saying, why they're saying it, and seek other ideas and options, because, it may not be just one issue. You may not have a mental issue and this hurts and you don't sleep and this is a problem. It may not be all these separate issues. It may be you have a hormone out of whack, and if you fix it, A, B, C, and D problem go away.
Which is amazing. And
so I want people to really be able to.
Yeah, that's perfect. Because for me, when I wasn't on it regularly, I had all kinds of symptoms, and what you're saying is true. So how can people reach out to you? Can they find you on Facebook?
Yeah, so Facebook, my name is Tomo Marjanovic. If you search Tomo, Tomo, I will usually be one of the ones that pop up. I think my profile picture's in a suit or something. You guys can go to Instagram. I'm pretty active on there. It's at Tomo_Marjanovic. You guys can email me at my work email, tomo@aspirerejuvenation.com. Of course, check out my two websites, aspirerejuvenation.com and aspiresups.com, SUPPS. And you guys can see my full nutraceutical line and also all the clinic information on there.
Awesome. Thanks for being here, man, and providing all this valuable information and, just being an advocate for not just looking a certain way, but feeling a better way. And I think that's what's really important. Appreciate it.
Absolutely.